Today, we're talking to Dr. Kwang-Bon Park, the co-founder of MIR Dental Clinic in Daegu, South Korea. MIR Clinic never closed during the COVID-19 outbreak. However, it did introduce some new safety protocols to protect their patients, over 150 dental professionals, and the patients numbering 400 per day. Importantly, there have been no cases of COVID-19 related to MIR Dental Clinic. As lockdowns are now ending and dental practices are able to open up again, there is a lot of concern among dentists and patients on how to stay safe. Therefore, Dr. Park, could you please introduce the key steps that MIR Dental Clinic used to show how to be safe and what the new normal is that we can expect from the dental clinics? Hi, Dr. Park.
Hello, Sabine.
Hi.
Hello, everyone. Yes, I'm happy to have this chance to share the strategy we've been using to fight this COVID-19. I know that all the dentists are happy to get back to work, and there are many patients waiting for our treatments. But things have changed, so we must do our best to understand how to keep our clinics virus-free in most economical and effective way. Dental clinics already have many safety protocols in place, but we still need to take extra steps to eliminate possible sources of infection and give confidence to our patients that our clinics are safe environments. So at MIR Clinic, we have focused on 3 areas. 1, a thorough disinfection protocol for clinic itself. 2, the safety protocol for our dental health professionals. 3, a safety protocol for our patients. Showing is believing. You need to show your clients how these safety protocols can protect them, just like this video. I hope you can make your own video to show your client how much you are trying. It's much more effective to make a video than sending just a text message. If you need materials for your video, please do not hesitate to contact us. We will share all the materials we have. Please contact to minek@imegagen.com or just send a text message to Subin to these numbers. Now I will explain step by step.
I'd like to introduce the steps of protocol for thorough disinfection for the clinic itself. Firstly, we disinfect the whole clinic 3 times a day with a fogging machine and wiping all the surfaces with a disinfectant before the clinic opens, during lunchtime, and after clinic closes. This includes all the spaces, not only treatment rooms, but elevators, waiting rooms, and bathrooms. And of course, we frequently open all the windows right after disinfection for ventilation. We also disinfect the clinic's environment in between each patients. We wipe all the surfaces of unit chairs and any possible infected areas where patients have touched with the HOCl-soaked towel. Safety and the well-being of dental health professionals are the most important thing. Just like we protect our patients, we must protect ourselves first. MIR Dental Clinic is taking 8 different approaches where each step makes the clinic more safe. For dental health professionals, everybody should be able to declare their health conditions to protect others. If somebody doesn't feel right, he or she should declare and should not show at the clinic and take rest and check until his or her health condition is okay. And the owners should understand and should recommend this kind of protocol to protect themselves. This way, everyone could stay safe. Now, is the fact symptomless people can also transmit viruses. So we have to prepare the protocols for protection, assuming everybody can be a possible virus carrier. The first step is to understand how the virus can enter your dental clinic. Of course, hands, clothes, and shoes are obvious means of transport. Many offices are just using an alcohol-based hand sanitizer at the entrance. However, alcohol doesn't kill viruses. It's better than nothing. However, there is no evidence that alcohol kills viruses. Then, what is more effective? There are many options, but I believe the HOCl is the excellent choice. At a concentration of 60 to 70 ppm, which is what we are using at MIR, HOCl has no smell, it's not sticky, and it doesn't irritate your eyes and the skin. So, right at the entrance, we have a special misting machine called the Corona Shield, which is operated by a foot pedal to disinfect the hands, clothes, and the shoes. Next, we have a temperature check in the lobby. So, any step or patients with a high temperature over 37.5 degrees Celsius are denied to work or denied to be treated and rescheduled. As you know, there were many cases of impacted people that didn't show high temperature. So we cannot clarify the impacted people just with the temperature checking. Even this is important. So we need to take other steps. As the virus multiplies mainly in the nasal and the oral mucosa at the initial stage, we recommend that all staff should gargle before meeting with any other steps. For this, we are using povidone iodine, known as betadine, which have been shown to kill viruses within seconds. For extra safety, you can also use betadine as a nasal spray. Just be aware that people with thyroid problems or allergy to iodine should not be given povidone iodine, in which case other gargles can be substituted, such as HOCl gargle. It was explained at the beginning, 60 to 70 ppm of HOCl solution can be used as gargle. It's harmless to the human body, so it can be used as gargle, and we have articles on this. However, be careful not swallow this gargle. With these procedures, our staff's hands, shoes, clothing, and mouth are all disinfected and virus-free. So, what can we prepare for ourselves during the treatments? To prevent the COVID-19, there are two ways, chemical and mechanical protection. Now, it's time to consider mechanical protection. Everybody understands the importance of wearing a mask, facial shield, and the gloves. But some of our colleagues recommend to wear very high-level PPE. But summer is coming, and the weather is getting too hot, and this makes us uncomfortable. So in my personal opinion, simply wearing a dental mask, gloves, and the facial shield is enough for normal treatments. And a high-volume extraoral evacuator is strongly recommended to minimize the contact with the aerosol during treatment. For patients, it starts before the patients visit our clinic. As MIR staff call every patient to check their health condition on the phone before confirming their appointments. And once they are at the clinic, they should disinfect their shoes, clothes, and hands with the self-misting machine at the entrance. And then they should check their temperature. Also, before any verbal contacts with our staffs, we recommend patients to visit the bathroom to gargle with the betadine iodine. Our patients are now almost virus-free with all these procedures at this moment, and now we can start the treatments. Even with these procedures, there might be some virus in the patient's mouth. That's the reason why most of us are afraid of the aerosol during the treatments. So, how we can manage this? At MIR Clinic, we have a special RTL arm on each chairs. But this is quite expensive and need to be installed with the special engineers. This is the strongest and the recommended tool. If you have a chance to consider in the future, please take this. And there are many mobile extraoral evacuators in the market. This is also helpful. But these mobile extraoral evacuators circulate the air in the room. So you need to change the filter more frequently than the company's recommendation. Otherwise, the virus can be circulating in the room. Last but not least, we have a duct vortex, a funnel connected to the suction hose of the unit chairs. This is like a facial shield of a patient. Duct vortex can suck quite a large amount of aerosol, but the main function is to make
another barrier between patient and dentist. It's cheap and can be used immediately. In between the treatment, as I and my staff actually disinfect our gown with HOCl using the self-misting machines. If you change your gown every time you see the patients, this is time consuming and the cost. So for me, the best way to sterilize is to use the same misting machine. When the patient finishes the treatments and head home, we recommend for them to use the misting machine once again to make their family safe from any possible transmission from clinic. The same step for our own steps when they finish their work and go home. Lastly, we strongly recommend our clients to take vitamin D to increase their immune systems. I really hope all the dental health professionals can follow these protocols to protect themselves. That can also protect our patients.
As many clinics are now suffering financially and need to find ways to recover under the new normal, how has MIR Clinic refocused their treatment paradigms to minimize chair time and maximize the number of patients?
Most of the dental professionals already lost at least 2 months of income. So we have to recover quickly, otherwise we cannot survive. So we need to find a way to minimize the chair time and increase the safety and importantly, increase our revenue. In the new normal, we will be having a new treatment workflow, we should think about these steps. As an implantologist, I have 2 main sources of income, surgery and the prosthetics. I have actually focusing on surgery nowadays rather than restorations. Even in surgery, I'm trying to reduce patients' visits and minimize the chair time. So I usually do immediate implant placement following extraction whenever it's possible. For the immediate implant placement, we need to use an implant system which can provide a high initial stability, such as Enrich implants. We have so many studies and publications on this. So now is the time to take full advantage of this implant system and save your time and the time of your patient. Also, we need to consider more digital way of implant treatment, especially in the new normal. In my case, I'm trying to use digital guides more and more. Of course, it takes a little more time preparing the digital guide. However, it is much more convenient and prognostic. I can prepare a temporary crown together with a surgical guide that can efficiently minimize my chair time, depending on the patient's conditions. So we can do flapless surgery and immediate loading. Even it's delayed, we are still prepared with the temporary restoration, and we can deliver it anytime when the implant is ready without additional procedures. There are lots of precise software out in the market, so try the digital way. AltoGate, which is our own software, can be a good solution for you. It's really accurate and convenient to use. It's ideal to do every treatment in digital way. However, you may not be under a good environment for digital way. So we have developed a new abutment systems that combines the digital and the conventional way. We have named it as R2UC abutment, which is a prefabricated anatomical zirconia abutment. It is really convenient, eliminate the need for further impression, and more importantly, is inexpensive. It will be available in European countries soon.
I understand that HOCl is harmless to the human body and the environment, and can even be used as a gargle.
That's right. HOCl is also called neutral electrolyzed water and highly effective as a gargle. There are so many studies and articles on HOCl related articles, so please check our website for more information.
MIR Clinic is using a lot of HOCl, and I understand that you're making it here.
Yes, it is inexpensive, quick, and easy to make. Since we are a large clinic, we are making a large quantity of HOCl using the SLB 120 machine. But if you only need smaller quantities, I'd like to recommend using eClean 50, which works almost like a kettle.
So for more information, I would like to call Lauren Huang, the head of Megagen International Network of Education and Clinical Research. Hello, Director Huang. Could you elaborate on how these two machines could produce HOCl solution?
Hello, everyone. Based on the success of the HOCl infection control protocol used at MIR Clinic, we've actually received so many inquiries. Therefore, first, I just want to mention a couple of things about why we are using HOCl. At this point, we know that the new coronavirus, or SARS-CoV-2, is an enveloped virus that relies on a rather weak protective lipid coating, which supposedly makes it easier to kill compared to non-enveloped viruses such as norovirus. Although there are no direct studies on the ability of HOCl to kill SARS-CoV-2, HOCl has previously been shown to deactivate the harder to kill norovirus, which is why HOCl is listed by both the US and EU EPA as presumed to be effective against SARS-CoV-2. Now, let's look at the HOCl we are producing. There are two important indicators for HOCl, the pH and the ppm, or parts per million. First, when making HOCl, we check for a neutral pH between 5.0 and 6.5. This is important as the pH indicates which species of chlorine is present. A neutral pH indicates the presence of hypochlorous acid, HOCl, which is what we want, whereas a higher pH means the presence of more hypochlorite ions, which is essentially bleach, while a lower pH indicates more chlorine gas. The neutral pH also means the solution is harmless to humans and the environment. Second, we make sure that the ppm, or parts per million of chlorine, is between 50 and 100. This is important as the ppm determines the disinfecting power, where studies have shown that below 50 is not as effective, while up to 100 is safe for humans and surfaces. At MIR Clinic, we use the same strength of HOCl, that means between 50 and 100 ppm, for all our surface cleaning, misting, and fogging. Plus, the presumed kill time, which means the time it takes for HOCl to kill SARS-CoV-2, is less than 10 seconds, based on previous studies with other viruses, such as norovirus. It's really that fast, which is important and impacts the cleaning time required between patients. The HOCl we are using is made with a SLB 120 machine that produces 120 liters of HOCl per hour. So this machine is definitely more appropriate when large quantities of HOCl are required. The starting material is 3% diluted hydrochloric acid, which is mixed with water and electrolyzed to make HOCl. This machine can be operated with various voltages, from 110 to 230 volts, making it internationally friendly. However, the eClean 50 is clearly more appropriate for individual clinics. In this case, the starting material, the Kedilite reagent, is already included. And remember the importance of measuring the pH and the ppm? Well, the eClean 50 package also comes with special safety indicators to make sure the pH and the ppm are correct. So I tried using the eClean 50, which works and looks just like a kettle. To make half a liter of HOCl, you just add 1 milliliter of the Kedilite reagent, which is a really small amount, to 500 milliliters of tap water, not distilled water. Then you press the button once, and 3 minutes later, you have neutral HOCl with a ppm between 50 and 100, which of course you can test and confirm yourself. As the tap water pH differs in different countries, it's good to experiment and find the correct ratio. It took me a couple of tries to get it just right, but actually it was quite easy and straightforward. Again, the eClean can be operated with various voltages, so no problem. One more issue. You need to store your HOCl in a light-resistant bottle. and use it within 2 weeks, as HOCl is inherently unstable, which is partly why it's so effective as a disinfectant.
Then, where is this equipment available?
Of course, there are various machines on the market that can produce HOCl, but if you're interested in the equipment we are using, please contact us directly at this address. The unit prices for the equipment we have shown in this video are as follows: 185 euros for the eClean 50, 1,450 euros for the Corona Shield HOCl misting machine, which is amazing, 80 euros for one box of 80 hoppers, or 40 euros for one box of 40 hoppers, which we are calling Dr. Vortex, and 320 euros for the special arm attachment to hold the hoppers. The shipping cost is additional and will depend on the weight of the product, and of course everything will be shipped priority. Since all these items are customized and in high demand, it will take about 2 weeks to prepare, plus the shipping time. Bottom line, as you can see, this type of infection control is very economical and flexible, and it has already been shown to work. So you, your staff, and your patients can all feel safe and confident. That's the key.
This infection control system is very economical and flexible, so our staff and patients can feel safe and confident. That's the key. Thank you, Ms. Huang. So as most of the lockdowns are coming to an end, we're facing the new normal with the possibility of new opportunities. So Dr. Park, do you have any further comments for your colleagues?
Yes, we need to be confident with the extra steps we are working. We protect our staffs and the patients. The steps I have mentioned are not expensive, actually just a few dollars, no more than $2 or $3 per patient, but they are really effective. And we have already shown this at MIR Clinic for many months. Our 8 different approaches also means that every step we take exponentially reduces the chance of a virus being transmitted. So if each step represents only about the 50% reduction, just for simple calculation, of course, there would be a higher percentage of possible protections. So with these 8 steps, chance of being infected is 0.025%. However, in reality, the percentage would even reach 0.001%. This is important for us to recognize. So many people assume that the dental clinics are dangerous environments. However, we should be able to say with confidence that our clinic is the most safe place. In order to show the people that our dental environment is safe, we need to keep following these rules of new normal era and prove people that we are protecting them. Thank you very much.